You're listening to Fast Facts, Ask the Expert with Katrina Sanders.
Hello, and welcome back to another episode. Today, we're diving into a hot topic that's been sparking a ton of controversy, and that is, what is the best way to clean dental implants? And more specifically, we're talking about ultrasonic tips. It's a topic that's been generating a lot of discussion in the dental hygiene community, and as always, we're here to unpack it with an evidence-based perspective. If you've been in the field for a while, you know that many of us were initially taught to use plastic hand scalers when working on dental implants. Sounded good in theory, right? Plastic is softer than metal, so it shouldn't damage that implant surface. But here's the issue. Those plastic scalers are often shaped like regular scalers for teeth, and we all know that posterior molars and round conical implants have very different shapes. So these plastic scalers were often too large to effectively get into the tissue or around the implant. And in many cases, it turns out they ended up leaving behind little curls of plastic into the threads of the implant. Not exactly ideal, right? In fact, a recent study showed that a whopping 60% of hygienists still rely on plastic hand scalers for implant maintenance, but only 7% of us actually find them to be effective. Even more concerning, 44% of surveyed hygienists report being unable to effectively treat dental implants at all. So we clearly have a problem here, and it's time for us to explore some better options. So, can you use an ultrasonic tip on an implant? That's the million-dollar question. The concern with ultrasonic tips is that if we're not careful, we could damage the implant surface, making it more plaque retentive in the long run. And this is where the coated ultrasonic tips will come into play. These tips are designed to minimize the risk of scratching that implant surface, which we know is key to preserving the integrity of the implant and subsequently ensuring that plaque does not accumulate more easily around the implant surface. So the question remains, should you always use a coated tip for implant maintenance? My answer as a periodontal hygienist is yes. When we're talking about maintaining a healthy implant, a coated tip should always be your go-to choice. Coated tips will help to clean effectively without risking damage to the titanium or ceramic surfaces, which, as we know, is essential for long-term success and avoiding complications. Now, what about treating peri-implant disease? Here's where things are going to get a bit more complicated. When you're working with peri-implant disease, especially in a periodontal practice, for example, you may notice that many hygienists do not rely on coated tips. And there's a specific reason for that. When you're actively treating peri-implant disease, you're not just performing a routine maintenance. You are actually working in the trenches. We're articulating into defects, debriding around the threads of the implant, removing infected tissue. So in those cases, we do need to use more aggressive treatment techniques in order to address the disease and eliminate infection. And coated tips, put simply, don't give us the full access we need. So in these cases, an uncoated ultrasonic tip, or in some cases even metal instruments, may be more appropriate. Of course, this comes with the caveat that we're dealing with an implant that's already diseased, and the goal here is to debride that surface, get into all those nooks and crannies to promote healing. So the approach is very different depending on whether the implant is healthy or diseased. Let's take a look at what the evidence says and back these recommendations up. Studies show that ultrasonic instruments, whether coated or uncoated, are effective in removing biofilm and plaque from implant surfaces. In fact, a study that was published in the Journal of Periodontology found that ultrasonic scaling with a non-metallic tip was just as effective at reducing bacterial load as traditional hand scaling. However, it also highlighted that the surface of the implant must be carefully monitored to avoid damaging the titanium and subsequently increasing plaque retention. When it comes to the use of coated ultrasonic tips, research suggests that they significantly reduce the risk of surface damage while still maintaining effective cleaning power. So, The key takeaway here is that for healthy implants, the coating is an added layer of protection to preserve the implant's integrity, which is vital in preventing future complications like peri-implantitis. On the other hand, when treating diseased implants, you may need to forego the coating in order to ensure you're able to access deeper pockets and more effectively debride the infected area. So what's the bottom line? Here's how I see it. For maintenance of a healthy implant, always go for coated ultrasonic tips. It's the safest bet to protect the implant and ensure a long-term successful outcome. However, if you're treating peri-implant disease, you might need to switch things up and use an uncoated tip in order to access the threads and defects where the infection may be lurking. The key is to understand the condition of the implant, whether it's healthy or diseased, and subsequently adjust your approach. At the end of the day, it's about knowing your equipment and using what you have in your arsenal for what is best for the patient. Ultrasonic scaling is an invaluable tool in implant maintenance and treatment, but just like any instrument, it is all about how and when you use it. Well, that's it for today's episode. I hope this helped to clarify some of the confusion around using ultrasonic tips on implants. As always, keep educating yourself, stay current with the research, and make sure you're providing the best possible care for your patients. Until next time, stay curious and keep learning. Please feel free to reach me on Instagram at The Dental Wine Hygienist or on my website, www.katrinasanders.com. Cheers.
Thank you for listening to Fast Facts Ask the Expert. If you have a topic you'd like one of our experts to answer, simply email me, Andrew at ataleoftwohygienist.com, and we will get it on the air as soon as possible. Thanks for listening.